The average lifespan has increased significantly over the past 2 decades. The U.S. population aged 65 and older increased by 39% in the past 10 years alone, showing unprecedented growth, with the group representing more than 55 million Americans today.
The lifespan has continued to increase over the past few decades because as the aging baby boomer market has grown, they've had more economic wealth, so they're able to have access to better health care and also for a better, healthier lifestyle. There's also been a continued drop in infectious diseases and cardiovascular related deaths. So with the advancements in technology in the healthcare industry, they're able to identify more treatable diseases earlier on to be able to treat those and increase the lifespan of people.
According to recent reports, nearly 90% of seniors want to stay in their homes as they age. Providing more than convenience, aging in place can help seniors preserve their overall happiness, health, comfort, and quality of life.
Living at home also helps to increase their sense of purpose. They get to maintain a lot of the chores that they did and gardening, and it helps to keep them happy and to keep them fulfilled with that sense of purpose. And I think it's also important to remember that they're not at home by themselves. There's so many options to help them.
Aging in place and staying at home definitely saves Medicare dollars. When you look at the average reimbursement that home health agencies receive for a patient at home for a 30-day period, it's right at $2,000. Compared to a patient in a skilled nursing facility, you're looking at a minimum of $11,000. So not only are you having a significant cost savings for Medicare, but you're also having improved patient outcomes.
The growing home care industry has expanded over the past 20 years to provide seniors with a way to stay in their homes. However, the demand for home care agencies far outpaces availability.
There's 10,000 Americans that are turning 65 every single day. So when you're looking at that along with the increased life expectancy, there's simply not enough home care agencies to meet the needs of patients to keep them at home where they want to be.
In our remote world today, we need to have information to data very quickly, and that's a huge liability for our corporations and our healthcare providers. And having access to real-time data is going to be critical moving forward.
Regulatory environment and compliance requirements can be daunting and almost insurmountable for entrepreneurs wanting to open a home care agency, creating challenges for those trying to get started in the sector.
New agencies in the home care industry are going to face the typical challenges that any new business would start up with. Specific to the home care industry, they're going to be challenged with the rules and regulations, which can be very complex, and it's going to be very different by state, and there's federal regulations depending on what type of services they want to provide. So there's a lot of things that they need to get involved with in the community to help the community understand who they are, what they provide.
Regulations change constantly. Here at 21st Century Healthcare Consultants, we specialize in assisting aspiring entrepreneurs start their own care agencies, along with helping existing agencies thrive. And we do that through our white label services, through our programs, and then also through our platform.
Designed to strengthen regulatory compliance efforts and increase proficiency, the integrated digital platform provides home care agencies with comprehensive documentation that is continuously maintained and kept up to date.
The importance of a compliance program that lies in the ability to ensure that healthcare providers adhere to the regulatory standards, they maintain that high standard of care, and then they mitigate that risk of non-compliance.
So many healthcare organizations are struggling with the complex regulatory and policy landscape, and so what our platform allows them is to have better visibility as to how their organization is managing individual staff members, compliance, as well as competencies to make sure they can drive the best and most optimal patient outcomes.
Through consistent adherence to standardized policies and procedures, healthcare providers can mitigate procedural errors, uphold meticulous record keeping, and manage risks associated with patient care.
The days of having to go home and find a computer and research what we need to do in order to take care of our patients are long gone. And to have the opportunity to have a platform where we can get real-time data to take care of the patients that we need and to provide them the care that they need to have that successful outcome, timely is so critical.
So many healthcare organization leaders are struggling with ensuring that their staff have adequate competencies to deal with complex regulations and policies, as well as difficult patient cases. And so what our platform does, it allows more experienced providers to interact with other field-based staff, all the way from their orientation period, as well as on an ongoing education basis.
With tailored training and educational pathways for staff members at various levels, the platform empowers skilled consultants and entrepreneurs who aspire to make a meaningful impact in elderly care through the delivery of excellent home care services.
We want to ensure that the providers, the agencies, and the caregivers, that they have the tools that they need. And that's in order to be able to deliver that high quality of care along with that value-based care.
So best-in-class healthcare organization leaders have realized that they have to make data as a key to how they're managing and running their businesses, and they're also under a lot of stress and pressure from regulatory agencies to set key performance indicators. And ultimately the benefit, of course, is they're driving the most optimal patient care and outcomes as well.